Assalamualaikum and hi. My name is Sarah Izzati binti Izzat Azrai, a final year student in Bachelor of Science Honours Biology. The title for my FYP project is SCN1A-Mutant Zebrafish Danio rerio as an advanced study model for Dravet Syndrome. I am supervised by Dr. Nur Fatimah binti Muhammad Yunus. Let's start with an introduction to Dravet Syndrome. Dravet Syndrome is an uncommon developmental and epileptic encephalopathy that affects infants with severe cognitive disability, repeating seizures, and impaired social developments. Most patients below the age of 6 months will show prolonged hemiclonic or generalized tonic-clonic febrile seizure with repetitive attacks. When they reach a year old, other forms of seizures like convulsive and non-convulsive status epilepticus will happen frequently. Afflicted patients have a more complicated condition presenting many symptoms beyond the normal epilepsy disease, with even a higher risk of sudden unexpected death in epilepsy. Dravet syndrome is caused by a loss of function mutation in the copy of the voltage-gated sodium channel alpha subunit 1 SCN1A gene. When this gene loses its function, it will lead to a hypoexcitability of GABAergic neurons, which then will cause SCN1A haploinsufficiency. 80% of Dravet syndrome cases are caused by mutations at this specific gene. As you can see, most cases are caused by missense mutation on this gene, while novel and deletion or duplication mutation on the SCN1A gene is the least common cause of Dravet syndrome. Recent studies have also confirmed that somatic mosaicism is also one of the causes of Dravet syndrome in some patients, which they may inherit from mosaic-affected or unaffected parents. Moving on to the zebrafish. It is a freshwater fish native to South Asia, mainly in India, Pakistan, Bangladesh, Nepal, and Bhutan. They are a popular aquarium fish that many people don't know about their other capability of becoming a model organism. This fish has been used as models for the functional investigation of genes in neurodevelopmental disorders and abnormalities in behavior. Hence, the objective of my review article is to give an insight to the readers on why the zebrafish can be accepted as an excellent Dravet syndrome model. My next aim is to find out how the zebrafish gene SCN1A-B is mutated to become an excellent Dravet syndrome model. Lastly, my aim is to review the existing and future drug treatments for Dravet syndrome in humans through the zebrafish models. Next, the research question for my review article are: why can the zebrafish be accepted as a Dravet syndrome model? How does the zebrafish gene SCN1A-B mutate to become a Dravet syndrome model? And what are the existing and future drug treatments for Dravet syndrome in humans through these models? The research gaps are that only male zebrafish can be used for ENU mutagenesis. Secondly, recommended drugs and treatments for Dravet syndrome are still not evidence-based, as there is a still lack of evidence in the medical literature. Lastly, there are currently no reports on how the effective concentration of drug use in the zebrafish larvae can relate to the human use. As direct concentration comparisons may not be practical in studies, current zebrafish screening procedures can only determine if a medication has anti-seizure capabilities or not. Similar to humans, the zebrafish possess 85% homologous chromosome that resemble our epilepsy gene. They have their own alpha subunit of the NAV1.1 channel encoded by two homologous genes called SCN1LAA and SC1LAB. Due to the duplicated paralog gene SCN1LAA being expressed, the homozygous SCN1LAB zebrafish become haploinsufficient for the NAV1.1 sodium ion channel. They also mimic the genetic etiology seen in most Dravet syndrome patients. This fish is much preferred among researchers in this field because of their inexpensive maintenance. They also can produce large progenies at a single time and have transparent embryos which are easy to manipulate and observe. Moreover, they save a lot of research time because they have rapid internal and external development. This table summarizes the techniques of inducing seizure-like conditions in the zebrafish. The first technique is by using PTZ to produce generalized seizures. The second method is by using ENU mutagenesis, which will create a random point mutation in the zebrafish genome, and recently using the CRISPR-Cas9 system to alter the gene transcription of the SCN1A gene. Out of all these techniques, the CRISPR-Cas9 system is the most efficient at creating a germline mutation in the zebrafish, while at the same time being inexpensive and time-saving. Dravet syndrome is one of the most difficult epileptic disorders to treat, and there is currently no cure for it. Current treatments given to the patients are just based on the guidelines created by the North American Consensus Panel. It is used to find the best combination of medication that fits the patient perfectly. With the help of the SCN1LAB mutant zebrafish, researchers can now clarify the lack of knowledge on using other repurposed drugs like the fenfluramine prescription. Fenfluramine can be used as an add-on therapy or as a substitute for stiripentol, achieving a near seizure freedom where only 0 to 1 seizures occur over a 14-week trial period. The Zebrafish model have been also used to examine the possibility of repurposing drugs like glycyrrhizin, efavirenz, and rizatriptan. A recent study had also shown that efavirenz was the most effective drugs compared to others because it exhibits a broader anti-seizure act on both genetically and chemically induced zebrafish models. The effectiveness of drugs or treatment for Dravet syndrome on human, the zebrafish model, and the mice model are compared in this table. The results shows that out of 12 currently used drugs or treatment, the zebrafish had scored 91.67%, similar to the effectiveness of anti-epileptic drugs used on Dravet syndrome patients. In conclusion, the zebrafish model is currently one of the most advanced models to study epilepsy and its epileptiform. Compared to the widely used mice model, the zebrafish has proven to be a better model because of its ability to mimic the genetic etiology seen in most Dravet syndrome patients. Besides that, the CRISPR-Cas9 system is one of the best techniques for developing the most relevant characterized zebrafish model, SCN1A-S552, that closely represents the NAV1.1 mutant in Dravet syndrome patients. Having said that, the zebrafish model is the ideal preclinical method to recapitulate most clinical phenotypes and drug developments for Dravet syndrome patients, since there is a 91.67% similar effectiveness to the currently used drugs or treatments in humans. The zebrafish model SCN1LAB has the potential to conduct drug screening for prototype anti-epileptic drugs along with repurposed drugs linked to anti-seizure activities. This model can be easily modified genetically, and it is proven that it can be a rapid screening platform to discover new precise medicine, not only for Dravet syndrome but other drug-resistant diseases too.